So my name's Jo and I'm a Musculoskeletal Therapist at Maximise Health. We basically cater to everything, so we look after the general population as well as sport specifics. So at Maximise we use the Chattanooga Shockwave Therapy machine. Quite handy for a lot of different conditions. We've used it on as young as 12 and 13 all the way up to about 75. So a lot of the conditions we treat would be chronic conditions, so a lot of plantar fasciitis, tennis elbow or even golfer's elbow on the opposite side. We have a couple of people who utilise the V-actor a lot, so they would be elite sporting athletes where they have chronic tight muscles, as well as the other end of the spectrum where they have muscle spasticity. We use Shockwave in conjunction with a lot of kinesio tape, as well as the complex dry needling and all your hands-on normal modalities, like you can use your massage, your trigger point therapy, your myofascial release. A lot of the times that we have people come in who use the Shockwave therapy, it's because it's the last straw, like they've not been able to find a treatment modality that's worked for them, and I think that's where we've had actually a lot of success with the Shockwave. With the Shockwave hand applicator, what we have is there's a bullet projectile in the base, and it actually is pushed along the tube and against the deactor head, which creates a pressure wave. So that pressure wave is then focused into areas of pain or injury of the chronic problem. So that what it does is it creates an inflammatory response to kickstart the healing process. A lot of the time, then the noise is enough to go, oh, okay, what is that? Is this going to be painful? And a lot of the time they will expect it to be painful. But what we can actually do is we bring down the intensity of the machine to make it more comfortable for clients. Or we can also use the V-actor head, which is a vibrational tool to help desensitize the area. So essentially we're lulling it into a false sense of security, and so we can actually create a more effective treatment for the client. So normally what you'd expect to see is some redness and tenderness in the area, but it's the same sort of side effects as you'd expect to see from any other hands-on treatment. But a lot of the time it's the positives, so the pain relief and the resolution of a chronic problem that people take away from that. So it's usually 2 to 3 treatments we recommend, but there have been quite a few that have had success from one standalone treatment. So we do usually recommend 2 to 3 follow-up treatments just to make sure it's a long-lasting effect. This sort of thing, learning about the latest techniques and studies that are out there, it upskills me, which helps me be a better therapist, which gets a better outcome for our clients.